My dear viewers, today I am going to discuss on EHRLICHIOSIS, commonly known as Canis in dog, which is simply a nightmare to veterinarians. Canine monocytic EHRLICHIOSIS or CME is caused by an organism known as Ehrlichia. Earlier it was known as protozoa, but now considered as nucleocytopenic bacteria. These bacteria multiply within the cytoplasmic vacuoles of circulating monocyte and macrophages. Disease may occur in cattle, horse, sheep, and dog. Human infection has been detected with E. canis in United States. Before I go to the transmission section, I want to say that ticks were not present in India in a large scale. But during the Vietnam War, some dead dogs were brought from Vietnam to India, and those were suffering from ticks. And therefore from there, tick spread to all the states of the country. Now tick has become a burden, not only a burden, tick has become a spreader of many diseases, which is very much concern to the veterinarian. In dog, Rhipicephalus sanguineus is responsible for transmission. So the one way of transmission is direct by the Rhipicephalus sanguineus. Second is blood transmission. If you go for blood transmission, it may, if the blood so collected is having the organisms, in that case it may spread to the recipient within 10 to 20 days. Organisms on entering will multiply in the monocyte of blood and spread to liver, spleen, lymph nodes. We know that the disease may be acute, subacute and chronic. In chronic form, known as tropical canine pancytopenia, which causes reduction of platelets, just like our dengue. Platelets count go down. And so far the cellular response is concerned, cellular immune response affords protection to a great extent. Dogs like GHD and Husky, they are the worst victim than the other breed of dog due to inadequate immunogenic response. That means protective power is less. And the puppies may remain as carrier for a long time, and stress may precipitate the disease. So stress is also an important factor in precipitating the disease. So far the clinical science is concerned, it is very important. Undulating temperature, right? Undulating temperature means sometimes the temperature is less, sometimes the temperature is more, right? So my suggestion is that you record the temperature 2 times in a day, right? Morning and evening. Then anorexia means you do not have any energy to take food. One thing I tell you, in the animal kingdom, an animal is healthy or diseased, that we can demarcate with the notion that whether it is taking the food or not. If taking the food, then the condition of the animal is not worse. Then there will be huge depression because blood is lost, pale mucous membrane as a result of blood loss. And if you look at the lymph glands, especially cervical lymph nodes, you will find it somehow enlarged. And most important point, which may draw the attention that it may be canis to the clinician, is epistaxis. Epistaxis may be unilateral from one nose, or it may be from both the nose, bilateral. Epistaxis, hematuria. Hematuria means red urine. Emesis means blood in the vomitus, hemorrhagic diarrhea, all hemorrhagic syndromes are seen. Then we can see vomiting, polyarthritis, labored breathing, back pain, seizure. Seizure, sometimes when you see seizure, you may think that it's suffering from epilepsy, but it is not. It is due to, immediately when we see a seizure, immediately we try to rule out the possibility of Canis by various tests and laboratory examination. Then polyuria, polydipsia. These are the clinical signs. Then maybe uremia, head tremors, cough, red eye, reluctance to walk, and shifting lameness. This is very important. There may be edema of the legs, and sometimes there may be shifting lameness. The lameness may not confine to one leg, it may go to the others. That is very important signs. So far the diagnosis is concerned, we will have to base on clinical signs. Of course, I tell you, so many clinical signs are there, so many clinical signs, different type of manifestations are there. It is very difficult to arrive at a conclusion. For that reason, it is mandatory for us to detect the organisms. Organisms may be detected with slide stain, with Giemsa stain, then serology, IFA or ELISA. But to my opinion, PCR is a rapid and sensitive test. And if you look at the blood picture, thrombocytopenia, that means your thrombocytopenia means thrombocyte is very less. Anemia in acute stage, mild thrombocytopenia in subclinical stage, and severe pancytopenia in chronic stage. So what the treatment is concerned, I tell you, treatment should be at the hand of the veterinarian. Still then I am mentioning some of the treatment which may be if the animal is dehydrated, so fluid transfusion, if there is anemia, there is blood transfusion, and supportive treatment with vitamin B complex and vitamin K may be given. As specific treatment as per the decision of the veterinarian, but doxycycline is the drug of choice. We can give doxycycline at the rate of 5 mg per kg twice a day or 10 mg per kg once a day. Or we have got even doxycycline injection which can also be given in certain cases. But imidacloprid dipropionate is the drug of choice, right? It can be given subcutaneous or IM. This disease has been considered to be a genetic, that means genetic aspect of the disease. So human monocytic EHRLICHIOSIS, HAE, or human granulocytic EHRLICHIOSIS or HGE has been recorded in some parts of the country. But we are not that much, we do not give much emphasis on genetic aspect of the disease because it is not so, it is not like other genetic diseases, but sometimes it may occur. It may occur in some human beings. Therefore, in a nutshell, this disease is caused by a unicellular organism which was earlier known as protozoa, then rickettsia, then now we are going bacteria. So nomenclature is varied depending on the nature of the organisms. And again, if you go for such diseases, the important aspect is tick. It is a tick-borne disease. Therefore, where from the tick population has come? It is presumed that during Vietnam War in 1970, some dead dogs with tick were brought in India, and from there it has spread. It has spread like fire. So in that way, we are the victim of tick, and it is a tick-borne disease. So my request to the owner will be that you try to remove the tick as far as possible. If you can remove the tick from your dog, you are at least safe from many diseases, and you will be in a position to maintain your dog in a befitting manner. Thank you.